Assalamu alaikum, dear students. This is the second lecture we are taking on the biomechanics of the ankle and foot complex. थोड़ा सा अगर हम चले जाएं towards the objectives. So initially in the yesterday lecture we discussed overview of the foot and then we discussed the general consideration of the ankle joint. We also discussed the proximal joint surface of the ankle joint and the distal joint surface of the ankle joint. We then also discussed the capsular support of the ankle joint and the ligamentous support of the ankle joint. Now we will discuss some other ligaments of the ankle joint, and then we will discuss the osteokinematics and the orthokinematics of the ankle joint and other joints of that foot. So हम मूव करेंगे towards the slide जहाँ से कल हमने एंड किया था और आज हम जहाँ से हम शुरू करेंगे. तो ये लिगामेंट्स हमने डिस्कस की थी कल. आज जो हम डिस्कस करने जा रहे हैं हम यहाँ से डिस्कस करेंगे. प्रीवियसली अगर हम देखें तो हमने डिस्कस किया था कि देयर आर टू साइड्स ऑफ द एंकल एंड medial ligaments and the lateral ligament. Medial ligament is commonly known as the deltoid ligament, and the lateral ligaments, they are three in numbers: the anterior talofibular, the calcaneofibular, and the posterior talofibular ligament. बाकी जो कुछ लिगामेंट्स और भी हैं जो आज हम डिस्कस करेंगे, इनमें से सबसे इम्पोर्टेंट जो है this is the plantar calcaneonavicular ligament that is present at the bottom. That straight is known as the plantar, and that ligament is present between the navicular, this is the navicular bone, and the calcaneum. So that is known as the calcaneonavicular ligament. This ligament is known as the spring ligament. So this is very important to remember. अक्सर एग्जाम में क्वेश्चन आ जाता है कि which ligament is known as the spring ligament. So this is the plantar calcaneonavicular ligament is known as the spring ligament. There are other two ligaments on the plantar side. One is known as the long plantar ligament and the other is known as the short plantar ligament. Here are the two plantar ligaments. This one is known as the long one, and this one is known as the short plantar ligament, while this is the plantar epineurosis, which is beneath these two ligaments. So these are also collectively known as the plantar ligaments, and plantar ligaments, then there are three ligaments: the plantar calcaneonavicular ligament, the long plantar ligament, and the short plantar ligament. If you talk about the osteokinematics of the ankle joint, so there is only 1 degree of freedom. हमने पहले भी डिस्कस किया था, एक ही डायरेक्शन में इसकी मूवमेंट्स होती हैं, and that is the dorsiflexion and the plantar flexion. Dorsiflexion means when the dorsum of the foot that's come towards the shin, it means the angle between the dorsum of the foot and the shin, that when decreases, it is known as the dorsiflexion. And when the angle between the shin and the dorsum of the foot, that is known as the plantar flexion. What we mean by the dorsum of the foot, this surface is known as the dorsum of the foot. This is the sole or the plantar surface. This is the dorsal surface. So dorsum of the foot, this is, and यहाँ पे ankle joint होगा, there will be tibia. बिल्कुल, this is the talus bone. इसके ऊपर बिल्कुल टिबिया एंड फिबुला का जो एंकल जॉइंट बनाएंगे, तो दैट इंटीरियर ऑफ द टिबियल बोन इज नोन एज द शिन. सो ये जो एंगल बनता है बिटवीन द टिबिया एंड दैट डॉर्सम, इफ इट इज इंक्रीजेस, it means when the foot is going in downward against away from the shin, so that will be the plantar flexion, and it is coming towards the shin, then that will be known as the dorsiflexion. So the range for the dorsiflexion is from neutral to 20 degree, and from neutral to 55 degree is for the ankle plantar flexion. If you talk about the orthokinematic moments, which is obviously the convex and the concave, there is posterior gliding of the talus and the ankle motrice when there is ankle dorsiflexion, and that is very important to remember that what happened during the when there is dorsiflexion, which is actually osteokinetic movement. Um, so what is the giant play during the dorsiflexion? So there is posterior glide of the talus and the ankle motor. There is interior glides of the talus and the ankle motor when there is interplantar flexion. So the point to remember is that during plantar flexion, there is interior glide of the talus, and there is dorsiflexion, there is posterior glide of the talus and the ankle motor. बाकी जो जॉइंट्स है रिगार्डिंग द पेरिफेरल जॉइंट मोबिलाइजेशन रेस्टिंग पोजीशन जो है दैट इज स्लाइट एंकल प्लांटर फ्लेक्शन अप टू 10 डिग्री एंड द क्लोज बैक पोजीशन इज द फुल एंकल dorsiflexion. अच्छा, what we mean by the close back position, that mean when there is locking and there is very difficult to move the ankle joint and there is less movement, so that is known as the close back position. A resting position is when there is more chances of its mobility is increasing mobility, जहाँ पे हम mobilization भी दे सकते हैं. This is the resting position known as, and that is almost 10 to 10 degree of the plantar flexion. बाकी जो पोजीशन है प्रोनेशन एंड सुपिनेशन ऑफ द फुट, इसको हम किस तरह जो है कंसिडर करते हैं. अगर हम सब टेलर जॉइंट या टेलर कल्किनियस जॉइंट विच इज एक्चुअली बीनीथ बिलो द एंकल जॉइंट, उसमें इन्वर्जन एंड इवर्जन होती है. अब ये इन्वर्जन एंड इवर्जन जो है ये जब डॉर्सिफ्लेक्शन और प्लांटर फ्लेक्शन साथ साथ एडक्शन ऑफ द कल्किनियन जो है या एबडक्शन ऑफ द कल्किनियन जो है, इसके साथ जब ये मिल जाते हैं तो सॉरी फोर के साथ, तो ये कंप्लीट जो है प्रोनेशन बनाएंगे या सुपिनेशन बनाएंगे. सो वी कैन से दैट प्रोनेशन एंड सुपिनेशन इज एक्चुअली द कलेक्शन और द कॉम्बिनेशन ऑफ थ्री मोमेंट्स. When there is dorsiflexion at the ankle joint, when there is calcaneus eversion at the subtalar joint, and when there is abduction of the forefoot, which is actually the external rotation of the foot. So the combination of these three movements will be called as pronation. So the major component is the eversion during the pronation, while supination, that is the inversion. During the inversion, there is plantar flexion. During the supination, there is plantar flexion at the ankle joint. There is inversion at the subtalar joint. There is adduction of the forefoot, which is actually internal rotation of the forefoot. And the combination of these three movements, the plantar flexion, inversion, and adduction, will be called as supination. So simply, when the dorsum is towards the medial side, and the sole of the foot is towards the outside laterally, so that will be the eversion, and the opposite will be the inversion. So this is eversion, this is inversion when the sole of the foot is in direction to the opposite foot toward the medial side, so that will be inversion. Arches of the foot, there are two arches. One is known as the transverse arch, the other is known as the longitudinal arch. A transverse arch that is made of the metatarsus, and the longitudinal arch is made of those number of bones on the longitudinal direction. Then the longitudinal arches, there are two in number. This is the lateral arch and the medial arch. The medial arch is much higher and prominent than the lateral one. So these are the longitudinal arches as we discussed, and this one is the transverse arch. These two are the transverse arches. This one is the medial longitudinal arch, and this one is the lateral longitudinal arch towards that small toe. Towards that big toe, that is actually higher than the lateral one. This is known as the medial longitudinal arch. So two types of arches: transverse arch of the foot and longitudinal arch of the foot. Then longitudinal arch of the foot, there are two types: the medial and lateral longitudinal arch. The medial longitudinal arch is made of the calcaneus, talus, navicular, three cuneiforms, and three metatarsals. The medial one, the medial metatarsus. If we talk about which bone is not the part of this medial longitudinal arch, that is the cuboid, which is actually on the lateral side, which is actually the member of the lateral longitudinal arch. So the calcaneus, talus, navicular, and three cuneiforms. So if we count these make six tarsals: one, two, three, and three cuneiforms. While there are seven tarsal, it means the cuboid is not involved in the medial longitudinal arch only, and the remaining all six tarsals and the three metatarsals, they collectively make that medial longitudinal arch that is higher and more important than the lateral longitudinal arch, as we discussed in the previous slide. Tailor head, it is considered as the keystone of the medial longitudinal arch, which is really important for examination point of view. अक्सर question आ जाता है that among these six bones, which is the calcaneus, talus, navicular, and three cuneiforms, which one is called as the keystone? So that is the tailor head. Yeah, talus bone, or is more specifically, the head of the tailor is considered as the keystone. The lateral longitudinal arch, much flatter. It means its height is less than the medial one. Rest on ground during the standing. And calcaneus, cuboid, and the latter two metatarsals. As we discussed in the previous slides, that the medial longitudinal arch, the three medial metatarsals, they are the components of the medial longitudinal arch, but the latter two metatarsals, the calcaneus and cuboid, they are the components of the lateral longitudinal arch. So cuboid was absent in the medial longitudinal arch. Two notable features of this arch are its solidity and its slight elevation. Two strong ligaments, the long plantar and the plantar calcaneocuboid, together with the extensor tendon and the short muscles of the lateral toe, preserve its integrity. We discussed what is the long plantar ligament. That is also there are another ligament, the short plantar ligament. So this is the medial arch. And if you look at the bones which make these arches, so this is the calcaneus, this is the talus, the navicular, the cuneiforms, and then the three medial metatarsals and the three cuneiforms. They all make the medial arch, also known as the inner arch. While the lateral arch is made of the calcaneus, that is the cuboid, and the lateral two metatarsals. If you look at the height, this height is much more than this one. So this is less higher and this one is more higher. Now the transverse arch of the foot, that is from side to side, in the longitudinal arch was in that direction from calcaneus towards the metatarsal, but the transverse arch is from side to side, from left to right side. And these transverse arches are formed by the cuboid, cuneiforms, and the base of the metatarsals. There is no navicular, there is no talus, there is no calcaneus. So the head of the bases of those metatarsals, the cuboid and the navicular, cuboid and the cuneiforms and the base of metatarsal, they will combinedly make the transverse arch. There is no navicular involved. So there are normally this is the normal arch, but when there is abnormal, when there is too much height of the arch, when the arch height is more than the normal, then it is known as the pes cavus. And when the height of the arch, especially on the medial side, this is less than the normal, which we call as the flat foot, that will be known as the pes planus. So there are two conditions. One is known as the pes cavus, the other is known as the pes planus. The pes cavus is the high arch position, and the pes planus is the flat foot with the low arch position. Movements and major muscles. Dorsiflexion, that is the muscle responsible for the dorsiflexion is the tibialis anterior. For the plantar flexor, the muscles which are important, that is the calf muscles, that is the gastrocnemius and the soleus muscles. These both are the plantar flexors. Similarly, tibialis inferior, The peroneus longus and peroneus brevis, these three muscles, they are the inverters. They are responsible for the inversion, while the everters, they are the peroneus tertius. So these are the muscles which are responsible for the dorsiflexion. This is the tibialis interior. The other muscles which help these are the extensor digitorum longus, the peroneus tertius, and the extensor helicis longus. The plantar flexus, there are two muscles, the gastrocnemius and the soleus one. These both muscles are present in the calf, just below the knee joint. The important point to note is that the soleus is deep muscles, while the gastrocnemia is superficial to the that soleus, and both insert into the calcaneus tendon, also known as the Achilles tendon. That is the Achilles tendon. So both the soleus, this is the soleus muscle, and this is the gastrocnemius muscle. Soleus muscle is a single head muscle, while the gastrocnemius is a double head muscles. One is known as the medial head. This is the medial head. This is the lateral head. This is the medial head. This is the lateral head. This is the popliteal fossa. And these two muscles combine in a single tendon which insert into the calcaneus, which is known as the Achilles tendon. Somehow there is a third muscle as well, but it is very small and that is a little thin, like a nerve, and that's why it is no such big role in the plantar flexor. That muscle is known as the plantaris. So if it is counted, then there are three muscles in the calf. That is the gastrocnemius, double-headed, the soleus, and the plantaris. But as that muscle is not so involved in the plantar flexors, so that's why here we will discuss only the gastrocnemius and the soleus. Then the inverters, there are primary inverters and the secondary inverters. All these muscles, they pass to the middle side of the foot just because they are causing the inversion of the foot. So the primary muscles which are responsible for the inverters, they are the tibialis interior and the tibialis posterior. And the other muscles which are helping these two muscles, that is the accessory muscles, the extensor hallucis longus, the flexor digitorum longus, and the flexor hallucis longus. The everters, the primary everters are the peroneus brevis and the peroneus longus, while the peroneus tertius and extensor digitorum longus, they also help these two muscles during the eversion of that foot. If we talk about the biomechanics of gait, here we will not discuss in detail as we will discuss in the next semester, inshallah, biomechanics of gait. The human gait, that is actually made up two phases. This is the stance phase and the swing phase. The stance phase is made up 60%, while the swing phase is the 40%. Then there are further phases of the stance phase, which are the heel contact, also known as the heel strike or the initial contact. Heel strike is the terminology in the traditional classification, while RLA classification, according to RLA classification, it is called as the initial contact. Foot flat, according to the traditional classification, while in the RLA classification of the stance phase, this subphase is known as the loading response. In mid stance, there is a similar terminology to both the traditional and RLA classification. What these RLA classification and traditional classification mean? There are two types of classification through which we can divide the different subphases of the gate. We will discuss them in the next semester, so there is no need of detail. Heel off, also known as the terminal stance in the relay, and then the last one, the toe off. So these are the 5 subphases of the stance phase, and these complete 5 subphases, they make 60% of the total one cycle of the gate. The swing phase, which make 40% of the total gate, there are 3 subphases, which we call as the acceleration or deceleration. the initial swing or the terminal swing, or we can also add is called as the early swing or the late swing. So the acceleration of the initial swing is also known as the early swing, and that start after the two off. Then there is the mid swing, and then there is another heel contact. If you look at the heel contact, this is a stance phase. So here the heel contact is actually the end of the swing phase, and that just before the end of the heel contact, just on the before the heel contact, this phase after the mid swing is known as the deceleration phase, the terminal swing phase, sub phase, or the late swing phase. So if we didn't discuss the stance phase and the swing phase, these are the two phases of the normal walking. If we are talking about the gait in running or the stair gates, and then these percentages that change. Kindly correct the spelling. This is not GATE. This is Biomechanics written. I apologize for that. This is GAIT, not GATE. So kindly consider this spelling as GAIT rather than GATE. So kindly correct this one. These are in the one gate cycle. This is the stance phase. This is the swing phase. And then in the stance phase, this is the heel strike. This is that loading response at the flat foot. This is the mid stance where all the bodies that is on the leg. This is the toe off. This is the heel off. This is the toe off. So these five phases, they are known as the stance phase. While in the swing phase, uh, just after the toe off, there is the early swing. This is the mid swing, and this is then the late swing. Are the acceleration, mid swing, and deceleration are the initial swing, mid swing, and the late swing. There is two single support and two double support. Um, if we look at where we have the double support, so double support is mean when both the limbs are on the ground during that single gait cycle, they will be known as the double support. So in the start of the gait cycle and just at the transformation from that stance phase to the swing phase, at the end of that stance phase, we have again another double support. So these double support, they make 20% of the total gait, while single support, they make 80% of the total gait. So one gait cycle can be defined as the gait, the walking from the right heel strike till the heel strike of the another right. So these it mean a single gait cycle is made of two steps, the right step and the left step. It means if the length of these two steps that is equal, then this is known as a symmetrical gait cycle. And if the length of these two is not equal, it means one step is short and the other is long and lengthwise, then there will be known as the asymmetrical gait. So now the distance covered by, suppose from the heel strike of right till the heel strike of the left, this is known as the step length. And from the heel strike of the right foot till the next heel strike of the same right foot, that will be called as the stride length or the distance covered by a single gait cycle. So these are the different phases of the gait. And that was all about the biomechanics of the ankle and foot complex. If you have any questions, you can contact me through my email. You can contact me on my cell number. You can contact on my WhatsApp number. Inshallah, there will be no such query. And if you have, you can ask and you can text me anytime. Thank you so much to all of you.